I think my favorite part of participating in the research process is really being able to make a tangible difference. I earned my doctorate doing very basic cell type experiments, and while this laid the foundation for what I'm doing now, I think that the translation of that research is far more rewarding for me. And I'm a surgeon at heart, and I really like to see people get better after their operations, and this provides me an avenue to help be on the forefront of those developments and really participate in the patient's care at a very basic level. My research is divided into two main areas of focus. The primary research that I do from a translational science, which means benchtop to bedside, really centers around the development of post-traumatic osteoarthritis and knee injury. So this could be a meniscus injury, an anterior cruciate ligament injury, a sporting injury, something that then leads later in life to the development of arthritis. So arthroscopic knee surgery is the most commonly performed knee surgery in the United States. The majority of the population that has a knee injury has a problem with the meniscus. Now, this could be an isolated meniscus tear, this could be a meniscus and cartilage problem, or it could be the result of some more complex injury like an anterior cruciate ligament tear or an ACL tear. One of the important things that we think happens is after a knee injury, it starts an inflammatory process in the knee that makes lots of enzymes and cell activity that degrades the good structures in the joint. Most people who sustain these injuries many times have surgery, they get better, and they don't know that this process is going on. And so we call it a silent killer, and that's what leads to the development of post-traumatic osteoarthritis. So the focus of this grant is identifying targets for disease-modifying therapy and really understanding the process that happens while most people's knees don't even hurt. We are very much naive in understanding the mechanisms of post-traumatic osteoarthritis in both the knee, the hip, and the shoulder. So part of this line of research is applicable to many joints and is really understanding how does the cartilage and the other joint tissues respond to an injury. So physical therapy is extraordinarily important after a surgery because this is where you teach the muscles to be a muscle and to respond appropriately. It's really critical for a successful surgical outcome. But physical therapy also has a massive role in non-surgical treatment. Many patients who are developing knee pain or shoulder pain can be very effectively treated with proper physical therapy to restore what the body should be doing, but is not due to some pain or inciting injury. Another portion of my research is understanding what portions of the physical therapy really yield those performance and return to activities, because our goal is to return patients to the activities that they want and the jobs that they need. I think one of the most important parts of being a surgeon educator, especially within the research realm, is encouraging people to think outside of the box. But in order to think outside of the box, I think you have to understand what's in the box. And so I really drive my trainees to understand the literature that's out there and to apply the evidence-based approach to their practice of medicine, and then to start thinking of more innovative ways to expand that knowledge base.